Hello, everyone, and thank you for joining the Office of Higher Education's public engagement call. This is our first call of the year, um, and we plan this call to be an update on COVID and some COVID activity that the Office of Higher Education has been involved with. The Office of Higher Education seeks to engage with diverse communities to identify barriers in post-secondary education. The agency will work in collaboration with communities to provide equitable access to information and advice that lead to the pursuit of post-secondary education and/or training for all Minnesotans. My name is Nikki Oliver. I am the Director of Grants and Government Relations for the Minnesota Office of Higher Education. I'm joined by my colleague, Kat Kalima, who is our Communications and Outreach staff, and Commissioner Olson and Pam Garr from the Minnesota Department of Health. Um, I also would like to acknowledge that it is Black History Month. And with that, I want to give you all a quote from George Washington Carver, a Black scientist and inventor. Education is the key that unlocks the golden door to freedom. So part of our mission is to make sure every Minnesotan has access to their post-secondary education goals. So with that, I'm going to pass it over to Pam Garr, who is an epidemiologist at the Minnesota Department of Health, to give a presentation on kind of COVID impacts, COVID updates. Pam?
Thank you. I'll see if I can share my screen now. Okay, are you seeing the right thing, Pat?
No, we're seeing your presenter notes.
Okay. Switch it around.
And as Pam is trying to get the presentation up, I do want to mention our chat is open. So if you have questions, we'll try to field those and have those asked of the presenters today. Thank you.
All right, Pam, that looks great.
Okay, sorry about that, everyone. So I am Pam, and I'd like to give you an update on just the status of the COVID-19 response and how it relates to higher education. And you'll have to just excuse any oversimplification or under description, I guess. There are so many sources of information out there. And I'm going to try to really focus on what's relevant to all of you in higher education. The biggest thing that we have changed recently is reporting. So as many of you might have noticed in the recent past, people have been talking about how we can't keep up with this case-based reporting and case-based analysis of the pandemic. And truly, with the Omicron surge, things just got overwhelming. But we had this idea to go through a change in our surveillance even before the Omicron phase, just to move towards a more endemic or the regular surveillance we do for diseases that are in the community. So the reporting changes are to report to our team via the REDCap tool. And that's a survey where folks can add if they've met thresholds of the total number of cases, that is 3% or more of the number of on-campus students over a 2-week period, or an average percent positivity of tests performed by campus health services is 8% over a 2-week period. And that second one is for those campuses who have health services so that they are doing testing, or they're acting as a health services testing site. And then we also want to make sure we're capturing any unusual clusters or case incidents. We want to make sure we have our eye on any changes in disease severity, any hospitalizations that are happening. We do get this through our lab reporting and our provider reporting as well, but if all of the institutions can give us a heads up, then we all are in awareness of that. And of course, as I mentioned, healthcare providers and labs do continue to need to report through their portals. I just wanted to show you, we're trying to move the situation update from cases to hospitalizations. And these data are on the CDC website. It shows hospitalization change in admissions. And as you can see in the metro area, well, down below are the different percentages, excuse me. And the lighter you are, I guess the better. So you, there hasn't been a lot of increase in hospitalizations here. But as you can see in Greater Minnesota, we are still, the hospitalizations are still rising. So, you know, the problem we get into a lot of times with reporting data statewide is that the metro and Greater Minnesota really do have different profiles, generally speaking. So I just wanted to call that out, that although we are seeing things kind of, you know, people are sighing, having a little bit of a sigh of relief in hospital settings, et cetera, in the metro area, I think we're still waiting for that to come down a little bit in Greater Minnesota. But as I say that, I like to look at this hospitalization rate. Last week, we were at 28.5 statewide. And again, we are coming down for the first time in several weeks. So that's really great news. And then I'm just going to go right into the new guidance that just came out on Monday morning, actually, from CDC. We waited a little bit for this after those isolation and quarantine guidances were updated. And lots of key points here. Sorry for the busy slide, but I'll just run through these quickly. The first point is that IHE administrators can help this effort to slow the spread by encouraging vaccinations. So we kind of want to put that as our first point always, is that vaccination is really the key to getting us for going forward in this pandemic. Obviously, we've done a really good job in many areas, so just keep up the good work. Help increase vaccine uptake by providing information. And then, yeah, the first three are all about promoting vaccination. We do still follow CDC's recommendations on that fourth bullet for masking in public for everyone in areas of substantial or high transmission. And we are still in that substantial or high transmission. You know, there's a lot of conversations going on right now about masking. And we still do recommend that we continue to mask for the foreseeable future. The recommendation for isolation has been reduced to 5 days for everyone, and quarantine for a minimum of 5 full days. And that just depends, obviously, if you develop symptoms or test positive. And then obviously people who are severely ill or have compromised immune systems might need to isolate at home longer. Shared housing. This is one piece that I personally was waiting to see what CDC was going to say. We did feel that we had a pulse on this, that institutions of higher education congregate settings or residential halls, dorms, et cetera, are considered a lower risk. And that's really due to the lower risk of severe outcomes in this population. We have had hospitalizations and deaths, but they are quite low. And you know, in a case-by-case basis, obviously we should increase isolation and quarantine, as I mentioned in the previous bullet. But in general, we can follow the general public isolation and quarantine guidance. Another piece is that CDC is still encouraging folks to implement entry screening testing. So, at a minimum for those who are not up to date on their vaccines. And the new language is up to date, not fully vaccinated. Actually, fully vaccinated is still used for those who have the, if it's a 1-dose series, that 1 dose, so for Johnson & Johnson, and 2 doses for those series that are 2 doses. And then up to date is having that booster dose in place. And then the last bullet is talking about serial screening among students at a minimum, again, for those who are not up to date. And those testing pieces are also couched in the understanding that sometimes the access to testing, the resources needed to do this kind of testing can be quite burdensome on some facilities or some institutions. So, you know, we understand that can be a difficult balancing act, I guess. Again, from the guidance, the factors that inform the use of layered prevention are the level of community transmission. Again, we're still at high, but hopefully that'll come down soon. The vaccination coverage in the students, but also in the community. Any strain on the health system capacity. So that's kind of the reason to look at hospitalizations, bed use, et cetera. The accessibility of testing resources, and the use of any screening testing program. So when you look at all of those things, you know, that helps inform your mitigation strategies. And these are all familiar to you. I'm not going to need to go through all of these, but just again, top one is vaccination. We do still recommend consistent and correct use of masks, and those high quality masks, physical distancing, especially for those who are not up to date, and testing, and the rest are pretty common sense prevention measures. So just an update on booster dose vaccinations in Minnesota. These are by age group. So if you take a look at the greater than 18, sitting at 60%. And of course, that's all of those greater than 18. So that includes all the older folks that really are really very high with boosters at 80% over 65. But just giving you an idea of where those numbers are will help with community understanding of booster doses. We don't have a lot of information on how many institutions or campuses are requiring the booster dose, but we have heard from a few that is starting to happen. So hopefully those numbers will continue to increase. Just to get in the weeds a little bit for isolation, we do have these graphics on our website that helps with this new timing, I guess. So you're to stay home. So those are the little houses for 5 days, regardless of your vaccination status when you are sick. So if you're in isolation, if you're sick or you have tested positive, and then for the most part, you can return to most activities when you feel better on day 6. But we do recommend high quality masks for 5 more days. And then with quarantine, if you are up, these are parsed out by vaccination status. So if you are up to date, so that means you have your booster, you do not have to quarantine, but we do recommend those, the masking for 10 days around others. And if you have had COVID-19 in the past 3 months, again, you do not need to get tested, and and you just need to wear a mask for 10 days. If you are not up to date, however, we do recommend that you quarantine from the last day of contact with the person that you were exposed to with COVID-19 for 5 days, and then test on day 5. You can return to most activities if you're feeling well, you haven't developed symptoms and you tested negative. Again, wear a mask. And then if you do test positive, obviously, then you need to start the isolation period. Just also to talk specifically about the congregate settings or your residential halls. This is language right from CDC. While shared housing in IHE settings is considered a congregate setting, they're considered low risk. And I had also pointed that out earlier. They will, you are able to safely use the general public for the most part, general public recommendations. And some graphics there for if someone is in your home has COVID-19, how to work through that quarantine and isolation if that becomes a reality for anyone in the residential halls. And then screening testing with sufficient access to testing resources. This is a graphic from the CDC website. Implement universal entry screening. Really at any time, they're recommending that. So at the beginning of terms. And once you hit the moderate, then the moderate transmission, then screening and expanded screening testing at minimum for people who are not up to date with their vaccines, at least weekly. And then when you hit the substantial or high, they're talking that the recommendation really should be the entry screening, but also screening testing twice weekly. Again, I know that this amount of testing is not feasible for some institutions, and there are other ways to get at the positivity on your campus. There are pooled testing strategies, etc. So if you have questions about this, I really do recommend that you look for now on the CDC website. That pooled testing link there will bring you to congregate setting testings and can walk you through some of those strategies that will help reduce the resources that you'll need to put towards testing. And then lastly, I've been bringing this to the OHE, or excuse me, the IHE calls for the COVID coordinator calls every week, but we do recommend that you continue to explore testing options outside of the state testing. I know that a lot of you already do, but I just want to bring to your attention that the FEMA funds for a lot of the testing that we're sort of managing at the state is coming to an end at the end of March. The state did vet 11 vendors for this master contract program, so it makes it easier for you to enter into a work order and go through the process to have that vendor service your institution. And everything on this website on the right-hand side of the screen really walks you through how to do that. But if you have any questions, you can certainly email the testing group at MDH as well. And that's the end of my presentation. Thank you.
Thank you, Pam. I don't see any questions in the chat currently. And we will make sure everyone gets the links and information shared today. Also, these are being recorded and will be posted to the Office of Higher Education's Public Engagement website, where all our other previously held public engagement calls are also posted. If you have additional questions, you can still share them in the chat. Other than that, we'll get started with Commissioner Olson, who will be giving information and an update on a certified nursing initiative that was started last month, I believe, Commissioner, from the state in partnership with Minn State, some of our other colleges, and Department of Education, and Department of Human Services. But I'll pass it over to Commissioner Olson to give more detail, more information about that initiative. Commissioner Olson.
Well, thanks, Nikki, and good morning, everybody. Like Nikki mentioned, my name is Dennis Olson, and I'm proud to serve as the Commissioner of the Minnesota Office of Higher Education. First and foremost, just thanks for taking the time out of your busy day to join us this morning for our public engagement call. This is really an opportunity for us to share information with you in real time, but glad to have the recordings made available as well. If you want to take advantage of those recordings and share them with colleagues or others that may be interested as well. So honored to have the opportunity to join you this morning, just share a little bit about honestly one of the most exciting initiatives that my colleagues all across the state and I have been working to stand up. Like Nikki mentioned, it's called the Next Generation Nursing Assistant Program. And I'll note that I don't have a slide presentation for this call, but if you'd like to hear more, I'm actually going to be presenting today in the Senate Health and Human Services Committee at 1 o'clock. And I'll be joined by one of our lead partners in the initiative, Valerie DeFore, who's the Executive Director of the Health Force Center of Excellence at Minnesota State, at Minnesota State College and University System. So like you just heard from Nikki, we started not too long ago, actually, in late November of 21, right before the Thanksgiving holiday. Governor Walz issued a call to action, including setting an aggressive goal to recruit and train and deploy 1,000 new nursing assistants by the end of January of this year, by January 31st of 2022. He in turn asked me to lead the initiative, which is really an interagency initiative and work group, which includes representatives from multiple state agencies. You heard a few from Nikki, but the Department of Health, Department of Human Services, the Department of Education, Department of Veterans Affairs, many others. But we also had state agency subject matter experts, but also state agency leadership. Many commissioners joined me in our work group meetings that happen multiple times per week and have been happening over the course of the last couple of months. We also included some providers within long-term care. And of course, like I mentioned just a bit ago, heavy involvement from our Minnesota State Colleges and Universities system and individual campuses as well. So, Governor Walz and my colleagues at the Department of Health, at the Department of Human Services, Department of Veterans Affairs, et cetera, recognized an immediate need for nursing assistants across the state, with a special attention paid to those needs in long-term care settings. And as many of you on the call are probably aware, this is not a new need, as we currently have over, I believe, according to data from the Department of Employment and Economic Development, over 15,000 current vacancies in nursing assistants across the state. But starting this initiative really gave us the opportunity for some immediate relief in long-term care facilities all across the state that were most significantly impacted by staffing shortages as a result of the COVID pandemic. And as a matter of fact, some of you may have seen in the news over the course of the last couple of months, 400 members of the National Guard, 400 National Guard soldiers were and are actually currently still deployed in long-term care facilities to assist and serve as nursing assistants. And members of the Guard went through training similar to the training that we've set up now through this initiative on a really accelerated timeline. Members of the Guard were in training for 12-hour days, taking clinicals on the weekend, and we're really ready to be in long-term care facilities the following week. So quite an accelerated timeline. And I'll just say on behalf of myself and all of us involved in the initiative, we just express our deepest gratitude and appreciation to members of the National Guard that stepped up during this time of crisis. But our effort now really is focused on the 1,000, getting the 1,000 certified nursing assistants. And the ultimate goal was to provide a demobilization strategy for the National Guard to help these citizen soldiers return to their civilian lives, honestly. So, through the support of the governor and the legislature, we were able to secure a budget, and we utilized federal ARPA dollars, ARPA funds, and that has allowed us to support what we've called a barrier-free pathway for Minnesotans to earn their certified nursing assistant credential in a short amount of time, and again, get out into the workforce as soon as possible. The budget allowed us to cover all related expenses, including tuition and training expenses, any books a student may need, materials, scrubs, technology support, and other student supports that an individual student may need as well. And there were also budget items built in to support faculty, which in turn, can support these students on these programs or within these programs that are on quite an accelerated timeline, like I mentioned before. So our interagency work group began meeting in late November, and we immediately began working on developing the recruiting component, building awareness through all available channels that we had. We leveraged heavily social media, as well as some local engagement efforts. Our recruitment is still ongoing. And actually, you heard Nikki mention just about a month ago, in early January, we were able to formally contract with the Minnesota State Colleges and University System, and classes started almost immediately in January, right after the holiday break. And, within days here, we'll have our first group of over 300 students that have completed the program and will be eligible to take the certification exam. And finally, the most important of the initiative is to connect trainees to employment, obviously. So we're continuing to work on making those connections now in partnership with the Department of Employment and Economic Development, leveraging our career force system within the state, and working with public and private providers as well to make sure that those long-term care facilities have the necessary staff and resources that they need ongoing. Through the recruitment effort, there were a multitude, I should say, of efforts that were utilized to help spread the word. One of the first efforts that we stood up was to utilize the existing Health Force Center of Excellence website to garner some interest, and we were absolutely blown away by the initial interest. Thus far, we've had over 1,200 individuals enter their information on the form, and each person got an individual reply back, which in and of itself is quite a Herculean effort to be able to respond to over 1,200 interested folks and provide them with necessary information, and many times connect with them over and over to make sure that they had appropriate options available to them. We also then stood up a website on the Office of Higher Education website, or a web page, I should say, on the Office of Higher Ed website, and that is going to serve as the home for the initiative long term, and we'll continue to update that page as we have new student numbers of completers of the program, as well as information they may need as follow-up, connecting to any available resources. Appreciate Nikki dropping that in the chat. We had a lot of media interest. Some of you on the call may have seen news stories, whether they have been on TV or I've heard on the radio, in print, newspapers as well. Quite a lot of media interest, of course, around the National Guard component, but also some of the recent student success stories that we've had. A lot of the media stories have focused on students that are currently in the program or have recently completed the program, and just what an opportunity it's been for them to finally jump into a program and complete a credential and get out into the workforce. And it's really a result of providing a barrier-free opportunity for folks who have been on the fence, wondering whether or not they can afford to take a risk to complete a program. So happy to be able to give students the ability to make that choice and ultimately better their lives. One of the coolest components, I'll just say, that I enjoyed about the initiative early on was that we organized 20 local engagement calls as well. So we had county emergency managers, mayors, school superintendents, local college presidents from technical and community colleges across the state on the calls, city administrators, local public health representatives, and the response from those calls was absolutely incredible. And then finally, we sent a letter to all 201 members of the Minnesota legislature, not only sharing information, but also asking for their help in spreading the word to their constituents. And if we do have any legislators on the call today, I just want to personally thank them for partnering with us and for sharing that information. It was incredibly valuable and much appreciated. So where are we at right now? As a result of the efforts thus far, we now have today 314 students that have completed the training, and we have another 463 students that are currently enrolled in training programs. So 777 students total on our way to 1,000. And this alone is something to celebrate, but we also, as an exciting component of the initiative, have the ability to engage high school students as well. Students in Minnesota age 16 or older can actually serve as a nursing assistant. And across the state, we have 338 high school students currently in programs, many of which will complete here within weeks if they have not already completed at the end of January. And so, plenty of capacity still remaining. Minnesota State College and universities and the Health Force Center of Excellence are still adding programs, still adding class availability in areas where there's been significant student interest. So we continue building, and although if we're adding up all the numbers, we are well over 1,000 already, but we're going to continue to build to make sure that we have appropriately utilize the budget that's been appropriated to us, and make sure we provide the opportunity to as many students as possible, and as many long-term care facilities as we can partner with to make sure that their staffing concerns are alleviated. I'll just wrap up by saying, it's been an incredible response and journey thus far. It's only been a couple of months, quite a wild ride, honestly, that we're still on. But our colleges and universities really stepped up in a big way here. And so, I just have to personally thank all of our college presidents, deans, faculty, staff that have given extra time to make sure that this has been successful as it has. Our care providers have stepped up in a big way, folks from our state agencies. I can't thank everybody enough. I'll continue to do so. But we're still moving ahead, and so hopefully this is a positive update here. But like I mentioned, there are still opportunities. If you know of any students that may be interested, feel free to check out the website, the link that Nikki provided in the chat, ohe.state.mn.us/CNA training. And we'll make sure that we connect students. There's an ability there for the interest form to be filled out. There's an email address for general questions. And we'll make sure to continue to reach out and provide information as we have it. But again, thanks for the opportunity to share with you a little update here, and happy to answer any questions if there are any.
Thank you, Commissioner Olson. I'm not seeing any questions in the chat currently. That doesn't mean there won't be any later on or anything like that. If there are questions that anyone has, that you feel free, you can email myself, Kat Kalima. I'm also going to put our public engagement email address in the chat, and then we will also have it posted when we send out this video, because I know if anyone's watching the video, they're not seeing the chat. So you can also share your questions there. Also, if you have any input, any advice, any topics that you would like the office to share on calls like this, please feel free to share at that public engagement website. Email address, it's public.engagement.ohe@state.mn.us. And we will be doing our best to get panelists that are experts on the topics that you all request. We encourage questions, we encourage conversation. We want to also acknowledge this is one tool in the toolbox of public engagement. It was born out of us all being remote and in COVID. So we're also continuously doing a variety of things to try to engage with the public. We want to thank you all for joining. And like I said, and as the commissioner has reinforced, these are recorded and you can go and watch them later. We thank you all for your time. Thank you, Commissioner Olson. And again, thank you, Pam, for that presentation. And yeah, I'll pass it to Kat if Kat has anything additional to share.
I do. Thank you, Nikki, and thank you so much, Commissioner Olson. Appreciate your time and all of the great information you shared. I did just want to remind everyone really quick that we do have a really fantastic series around FAFSA and DREAM Act completion coming up, and actually we had our first one yesterday. We had 1,000 people register and 500 people join us yesterday. So they are recorded. They will be available for you to watch and to listen to and to share with everyone you know. But yesterday's was before the FAFSA. Next week, Tuesday at 7, we'll be discussing the FAFSA. Thursday at 7 will be the Minnesota DREAM Act. And then the following week will be about understanding your award letter or your offer letter. And then finally, on the 1st of March, Tuesday at 7, it'll be discussing scholarships. So please register if you haven't already. I'm going to put it in the chat. And we are partnering with the Minnesota Department of Education and ECMC, the College Place, in order to make this possible. So thank you, everyone. We appreciate you. And we'll stick around just for a minute or so to see if you have any other questions. But if not, be well, and thank you for joining us today.